you reach into a cabinet, or you wave goodbye, or you catch a glimpse of yourself in a storefront window mid-gesture, and you see it. The back of your upper arm moving independently of everything else. Like the skin got a different set of instructions than the rest of you. Most people assume that is just what happens. Time passes, arms get soft. That is the story they have been told, and they have accepted it. I am here to tell you that story is wrong. Not partially wrong, completely wrong. That hanging tissue is not the inevitable cost of getting older. It is a specific, treatable physiological breakdown happening inside the tissue right now. And if you do not address the cause, it will not stay in your arms. I am Ethan Reed. I have been practicing medicine for 15 years. Subscribe to Dr. Reed and hit the like button. We are building toward 1,000 subscribers, and every person who joins this channel brings us one step closer to making real clinical information available to everyone, not just people who can afford to sit in a specialist's office. Let me walk you through what is actually happening inside that tissue, because once you understand the mechanism, the solution becomes obvious. Your upper arm has 3 distinct structural layers sitting on top of the muscle. The outermost is your skin. Beneath that is a layer of subcutaneous fat. Subcutaneous simply means below the skin. And below that sits a thin but critically important membrane called the superficial fascia. Fascia is the body's internal connective tissue network. It wraps around muscles, organs, and fat compartments, and it is responsible for keeping your tissue layers mobile and separated. When fascia is healthy, the layers above it glide freely. When it is not, they fuse. The back of the upper arm, the posterior surface, is one of the most circulation-deprived zones in the human body. That is not an exaggeration. It is anatomy. Think about how you move through an average day. You reach forward, you lift, you carry, you type. Every one of those movements is driven by the flexor muscles on the front of your arm, your biceps and forearm muscles. The extensor muscle on the back, your triceps, the one responsible for straightening the elbow, sits largely unused. Extensor means a muscle that opens or extends a joint. Flexor means the opposite, and because the triceps is underused, the circulation to the entire posterior arm becomes chronically sluggish. Here is what that means at the microscopic level. Capillaries are the finest branches of your circulatory system, the tiny vessels that deliver oxygen and nutrients directly to individual cells. When a region of tissue is rarely moved and rarely loaded, capillary perfusion in that area drops. Perfusion simply means the rate at which blood is flowing through and nourishing the tissue. As perfusion drops, the fluid that normally cycles in and out of cells begins pooling in the spaces between them. Clinicians call this interstitial fluid accumulation or subclinical edema. It is hidden swelling. You cannot see it clearly from the outside, but it adds weight and softness to the tissue, and it sets the stage for everything that follows. With chronic low perfusion and pooled fluid, the fascia begins to dehydrate and stiffen. The layers that should slide against each other begin to stick. That sticking is a process called fibrosis, the formation of scar-like adhesions between tissue planes that are supposed to remain separate. Fibrotic tissue is rigid, poorly nourished, and poorly supported. Add gravity to that equation, and the result is tissue that sags. That is the arm you see in the mirror. Not a fat problem, not an age problem, a circulation and structural integrity problem. The goal here is to physically break the adhesions between your skin, subcutaneous fat, and fascia, and to force fresh blood into a region that has been starved of it. You are going to do this with a pinching technique, and I want you to understand exactly what to do and why precision matters. Place your hand on the back of your opposite upper arm. Instead of grabbing a large fold of tissue, take a very small, very superficial pinch, just the outermost layer of skin between your fingertips. The difference between a large grab and a small superficial pinch is the difference between a technique that does nothing and one that actually works. The small pinch isolates the most adherent layer. It will be uncomfortable, particularly when you first begin. In some areas, it will be sharply unpleasant. That sensation is clinically meaningful. It is telling you precisely where the adhesions are densest and where circulation has been absent the longest. Work slowly across the entire posterior arm surface. You are not rushing through this. You are mapping the tissue. The most uncomfortable areas are the areas that need the most attention. Spend extra time there. What you are doing mechanically is forcing a separation between layers that have fused, reestablishing the gliding planes that healthy tissue maintains naturally. The moment those planes begin separating, capillary blood flow to the region increases sharply. Oxygen arrives, nutrients follow, and the fibroblasts, the specialized cells responsible for manufacturing collagen, wake up and begin producing new structural protein. Collagen is what gives skin its firmness and elasticity. Fibroblasts produce it continuously in healthy, well-perfused tissue. In stagnant, adherent tissue, production slows dramatically. Manual mobilization reverses that suppression directly. Do this for 5 minutes daily. Over the first 2 to 3 weeks, you will notice the discomfort decreasing session by session. That is your feedback signal. The layers are separating. The fluid is clearing. The tissue is becoming vascularized again. If you have a partner available, the skin rolling technique is a more powerful version of this. Your partner lifts the skin of your posterior arm into a small fold and rolls that fold forward along the surface in a wave motion. On healthy, mobile tissue, this feels odd but manageable. On a posterior arm with years of adhesions and stagnation, it will feel deeply uncomfortable. That reaction is not a problem. It is confirmation of how much work needs to be done. The discomfort diminishes quickly with consistent repetition, and the visible improvements in skin texture and density follow closely behind. The muscle underneath the skin is not optional structure. It is an active support system. When triceps tone is low, and tone simply means the baseline tension a muscle holds even at rest, the skin above it has nothing firm to rest against. Restoring that tone is non-negotiable if you want lasting results. The narrow grip push-up is the most direct evidence-backed way to isolate and load the triceps. The technical key is elbow position. Keep your elbows tight against your rib cage throughout the movement. When elbows flare wide, the load shifts to the chest and shoulders. Elbows in puts the demand exactly where you need it. If a floor push-up is currently beyond your capacity, that is not a problem. Start at the wall, stand at arm's length, place both hands at shoulder height on the wall, and perform the movement from there. Wall push-ups are a legitimate strength exercise. They apply real load to the triceps at a manageable resistance level. Progress from the wall to a countertop or windowsill, then to a chair, then to the floor. This is progressive overload, the gradual increase in demand placed on a muscle over time, and it is the foundation of every scientifically validated strength protocol. There are no shortcuts. There is only progressive demand applied consistently. As triceps tone improves, blood flow to the entire posterior arm improves with it. The muscle exerts an inward tensioning effect on the overlying tissue. Combined with the manual work releasing the surface layers, these two inputs reinforce each other and the effect compounds. Stretching is not filler. It is a physiological necessity for the kind of tissue remodeling we are after. Before your push-up work, stretch first. Raise one arm overhead and bend it at the elbow so your hand drops toward the center of your upper back. Use your opposite hand to apply gentle pressure to the elbow, drawing it slightly toward your midline. You will feel a clear pull along the entire back of the upper arm. That is the triceps and its surrounding fascia under controlled lengthening. Hold for 20 to 30 seconds per side. Repeat the same stretch after your push-ups are complete. This post-exercise stretch is not optional. It accelerates the clearance of metabolic byproducts from the tissue, the waste compounds produced during muscle contraction that contribute to soreness and slow recovery. It also enhances nutrient delivery to the fibers that were just loaded. The net result is faster tissue adaptation and better long-term outcomes. One warning I give every patient who does this work: the shoulder is the most mobile joint in the human body, and that mobility comes with a cost. It is also the most structurally vulnerable joint we have. If you have a history of shoulder injury, a dislocation, a rotator cuff problem, chronic impingement, or persistent pain that limits your daily movement, do not push through discomfort during these stretches. Pain in a previously injured shoulder is not something to override. It is a signal with structural validity. Pushing through it can cause real damage that takes months to repair. If you have an unresolved shoulder problem, that requires a clinical evaluation, not a home protocol. This technique operates on a different principle than the others. Rather than controlled static force, arm swings use momentum. You swing the arm at enough speed that the tissue at the far end of the arc reaches a degree of stretch that static positioning cannot replicate. The brief but powerful end-range stretch that occurs at the top and bottom of the swing pulls the triceps and fascia to their true limit of length. Simultaneously, the small muscular effort required to decelerate the swing provides a low-level strength stimulus. You are getting deep tissue mobilization and mild loading in the same movement. This is why sports medicine incorporates pendulum and swing mechanics into rehabilitation. They accomplish simultaneously what separate exercises do sequentially. Use arm swings as your warm-up before the manual work or the push-ups. 1 to 2 minutes per arm is sufficient. The tissue on the back of your arm does not live in isolation. Your body is a single integrated structural system, and the same collagen and connective tissue that supports your posterior arm is supporting your jawline, your abdominal wall, your joint capsules, and the walls of your blood vessels. When connective tissue begins breaking down in one visible location, the breakdown is almost never confined to that area. In my clinical experience, patients who present with posterior arm laxity frequently show early changes in the neck and lower jaw, the skin of the abdomen, and sometimes the veins of the lower legs. In more advanced cases, weakened abdominal fascia contributes to hernias, protrusions of internal tissue through structural walls that can no longer hold them back. These are not separate problems with separate causes. They share one root: systemic decline in collagen synthesis and connective tissue integrity throughout the body. One of the most common and most correctable drivers of that systemic decline is vitamin D deficiency. Vitamin D is not simply a calcium and bone nutrient. It plays a direct regulatory role in collagen production at the cellular level. Vitamin D binds to receptors on fibroblasts, the same cells that build collagen, and increases their output. When blood levels of vitamin D are low, fibroblast activity is suppressed, collagen production slows across every tissue in the body, and structural integrity declines gradually and invisibly until it becomes visible all at once. This deficiency is not rare. Research consistently finds that between 40 and 80% of adults in developed countries have insufficient vitamin D levels, with the highest rates in people who spend little time outdoors, people living at northern latitudes, older adults, and people with darker skin tones. Correcting a vitamin D deficiency does not patch one symptom. It restores tissue repair capacity systemically. Better skin firmness, stronger joint structures, healthier vessel walls, improved immune response. All of it from addressing a single correctable deficiency. Do not guess at your level. Get it measured. The test is a 25-hydroxy vitamin D, abbreviated as 25-OHD, and it is a routine blood panel item. Target levels for tissue health are generally between 50 and 80 nanograms per milliliter. If you are below that range, work with your physician on a supplementation dose that is appropriate for your current level. Do not self-prescribe high doses. Vitamin D toxicity is real, and staying within the therapeutic range matters. Here is what I want you to take away from this. Your daily protocol is 5 minutes of manual pinch work on the posterior arm, narrow grip push-ups progressed to your current fitness level, and a proper stretch before and after every push-up session. Add arm swings as your warm-up. Check your vitamin D and correct a deficiency if one exists. No equipment, no clinic visits for healthy people, no expensive devices, just consistent, correctly applied input to a body that is biologically capable of repairing itself when you give it the right conditions. I am Ethan Reed, and I made this video because 15 years of clinical practice has shown me the same pattern over and over. Patients spending money on procedures that treat the surface of a problem while the underlying cause continues unchecked. The sagging skin on your arm is not the enemy. It is communication. It is your body telling you that something in the underlying biology needs attention. Address what it is actually saying, and the results go well beyond your arms. Subscribe to Dr. Reed and hit the like button. Every subscriber helps this channel reach people who are still being handed expensive non-answers to problems that have real, affordable solutions. We are working toward 1,000 subscribers, and every one of you matters. Share this with someone who needs it. That is how we make this information available to everyone.